Welcome to a deep dive into a rare and intriguing condition affecting the urinary system, bladder melanosis. Join us as we explore its origins, how it develops, and what can be done about it. The exact cause of bladder melanosis remains somewhat of a mystery, making it an area of ongoing research. It's generally believed to stem from an unusual accumulation of melanin pigment within the bladder lining, or urothelium. This melanin overproduction isn't typically associated with systemic melanosis, which is linked to melanoma. Researchers are investigating potential triggers including chronic inflammation, genetic predispositions, and even exposure to certain medications. However, concrete causative factors are still elusive. The pathophysiology of bladder melanosis centers around the melanocytes, the pigment-producing cells present within the bladder's urothelium. In normal circumstances, these cells are few in number and contribute minimally to the bladder's appearance. However, in bladder melanosis, these melanocytes either proliferate excessively, produce an abnormally high amount of melanin, or both. This excess melanin is then deposited within the urothelial cells, leading to the characteristic dark pigmentation observed during cystoscopy. The precise mechanisms that trigger this aberrant melanocyte behavior are still being studied. Due to its rarity, the exact epidemiology of bladder melanosis is not well defined. It is considered an extremely uncommon condition, with only a limited number of documented cases in medical literature. There appears to be no strong predilection for any specific age group, sex, or ethnicity, because it often presents asymptomatically or with symptoms overlapping with more common urinary conditions. It's likely underdiagnosed. Further research is needed to better understand its true prevalence within the general population. Bladder melanosis often presents without any noticeable symptoms, making it a challenge to detect early on. In many cases, it's discovered incidentally during cystoscopies performed for other reasons, such as investigating hematuria or blood in the urine. When symptoms do occur, they are generally nonspecific and can mimic those of other urinary tract conditions. These may include urinary frequency, urgency, dysuria or painful urination, and lower abdominal discomfort. In rare cases, significant melanosis could potentially contribute to bladder irritation. Diagnosing bladder melanosis typically involves a combination of clinical evaluation, cystoscopy, and biopsy. Cystoscopy, where a small camera is inserted into the bladder, allows the physician to directly visualize the bladder lining and identify the characteristic dark pigmentation. To confirm the diagnosis and rule out other conditions, a biopsy is usually performed. The tissue sample obtained during the biopsy is then examined under a microscope to confirm the presence of melanin deposits within the urothelial cells. Immunohistochemical staining can also be used to further characterize these cells and rule out other pigmented lesions. Bladder melanosis is not currently classified into distinct subtypes. It is primarily defined by the presence of melanin deposition within the bladder urothelium. The extent and distribution of the pigmentation can vary, but these variations are generally not used to define different categories of the condition. Treatment for bladder melanosis is often conservative, particularly when the condition is asymptomatic. Regular monitoring with cystoscopy may be recommended to observe for any changes. If symptoms are present, treatment focuses on managing those symptoms. In rare cases, if the melanosis is extensive or associated with significant bladder irritation, local therapies such as fulguration or laser ablation may be considered. However, these interventions are typically reserved for exceptional circumstances. Currently, there are no known specific preventive measures for bladder melanosis, primarily because the exact cause remains unclear. Maintaining good overall urinary health, including adequate hydration and prompt treatment of urinary tract infections, may contribute to minimizing bladder irritation and inflammation, potentially reducing the risk. However, this is based on general principles rather than specific evidence related to bladder melanosis. The prognosis for bladder melanosis is generally considered favorable, particularly when the condition is asymptomatic. In most cases, it does not appear to progress to malignancy or significantly impact bladder function. However, long-term monitoring with cystoscopy is often recommended to detect any potential changes and rule out other bladder conditions. Recent research is focused on elucidating the underlying causes of melanocyte proliferation and melanin production in the bladder, potentially leading to more targeted diagnostic and therapeutic approaches in the future.